Hi everyone, welcome. Today we are gonna talk about something that some people hide under makeup, some people hide under clothes, some people hide it emotionally for years. Today we are talking about the part nobody sees, psoriasis. And as we do, as usual, today we have again a partner from Asha Experience team. Dr. Trupti is with us. In a few minutes, I will have her. And everyone, welcome back. As you know, during May, we have agreed to do live sessions about our skin health to get ready for summer time. On our last session last week, we talked about why skin keeps coming back to the same place, the root cause of it, the stress connection, and what to do at home by ourselves. Today, we're gonna go a little bit more deeper because these are things about psoriasis that people almost never say about loudly. Not to their doctor, not to their partner, sometimes not even to themselves. We are shy of that subject. So, Dr. Trapti is back with me today, and we are going to talk about exactly those things. And let's welcome her on our stage, and she is with us. And during this session, again, as we do always, we will share some clues for you on the screen. You can take your notes and apply at home by yourself. Yes, Dr. Trapti, welcome. And again, can
Thank
you
you.
introduce yourself a little bit to the ones that met with you for the first time?
Thank you so much. Hello, everyone. I am Dr. Trupti Naikere. So I am basically a Ayurveda physician and also a researcher. I'm really glad we are having this conversation today because, like la in the last session, we already discussed Ayurveda and psoriasis, including the treatment part and what are the issues and everything. So, because psoriasis is not just a skin symptom, it affects your confidence, relationship, mental health, daily comfort. And a lot of people carry this burden for years. So today, let's talk openly about this thing, which people usually hide.
Okay, so let's start with something I think a lot of people deal with but never actually says. Paralysis doesn't always show up in visible places always. Sometimes it shows up somewhere you can't really mention in a conversation. Your scalp, your nails, your intimate areas. And that silence around it makes it so much harder to deal with. So I want to ask, how does Ayurveda see when the condition shows up in these places? Is it telling us something different?
So, yes, in Ayurveda, location matters a lot, and we just don't look at psoriasis and say this is a one skin disease. Psoriasis is not one single disease. We look at it where the body is expressing imbalance and what might affect you internally. Like it may internally affect, for example, scalp involvement is very common, right? Associated with the stress normally or sleep disturbances, or many times excessive heat in your body or system that may cause this. Even the digestive imbalances cause the scalp uh, flares. So sometimes nail area is there, nail changes are there, which indicate deeper tissue involvement, And many times, whenever it is associated with the nail, it is chronic in nature. It's there for years. And again, lastly, intimate areas, right? Like in the intimate areas, many people feel ashamed of it because it may look like STDs, STIs, and something gross, and it is emotionally very distressing. So,
And also, it
since it,
might hurt,
huh?
right? some discomfort, some pain can also be there
Exactly.
with them, which I
Right, right.
usually face with through my consultations. It's also,
Correct.
it's both embracing and it's also giving pain, and that makes suffering much more.
Correct, correct. Emotionally and as well as body image wise, comfort
Yeah,
wise, and
yeah,
closeness with your partner, all these things are there. And like this, it is there in intimate area. That doesn't mean like, any poor hygiene issues or like, any uncleanness is there or something. It's not, and but many patients carry this guilt, what I have seen. Many patient has this guilt because it's there and they are ashamed of it. Not just that, but the irritation associated with it, and we feel like patient feel very embarrassed. And even as a doctor, when I'm sitting there, patient is like, I just want to suppress this anyhow. They just ignore the inflammation, digestion, sleep, and emotional triggers, whatever causing it. They try to ignore it and just they are like they want to get rid of it as early as possible. So yes, this happens.
yeah. It's hard to talk. It's hard to talk about it. It's hard to show it, and you have to balance the pain that you have, and that makes huge stress. On the other hand, all these trying to hide it, trying to answer the questions about it also makes stress, and stress makes inflammation. So we are in a run trip that stress activates it.
Correct.
Activations makes more stress. We are in a loop that sometimes we get lost in it.
Yes, correct, correct. Exactly. But skin is trying to
Yeah,
communicate and telling us, ki, this is happening. You need to do something about it. But we are just worried about the skin, not about the other issues, right?
yeah, yeah. So we understand that through Ayurvedic aspect, the place of it is important in. It's not the same thing showing up in at different places. So while we are working with an Ayurvedic doctor or with an Ayurvedic practitioner, we must feel confident to share it exactly, truly, openly, what's going on and where it is going on. Because this will affect our treatment. So do not be shy about the place where we meet with it, right?
Correct, correct. Yes.
Okay, so I want to ask something about that. I think this situation, as you mentioned before, affects the relationships a lot, but nobody really prepares for you. You do not ask for it, or your partner doesn't ask for you about it. But when your skin is flaring, you are uncomfortable with it in your body. And also, how can you even talk about this subject with your partner? Is there something
Partner.
Ayurveda says, or kind of during this healing journey, does Ayurveda teach us how to come over it, how to handle it?
Yes, actually, this is very one of the most overlooked part of the psoriasis. People
Yeah,
normally, even on the Instagram, on YouTube, people normally talk about the remedies like cream. This cream works for this. This diet is
yeah,
working for psoriasis, but nobody talks about how the patient feels. How the patient feels like being touched, like he's uncomfortable being seen, being touched, and even repeating the condition again and again. You have this, I have psoriasis, and many patients, like I have seen, they withdraw emotionally during their time. Sometimes they avoid the intimacy. They stop communicating with their partners because they feel their partner won't understand. And this silence is very heavy. So Ayurveda looks at this holistically. As Ayurveda, it is for the entire body. It looks at
yeah,
this problem in a holistic way. Even the mental and emotional well-being are deeply connected with our physical healing. So healing is not just putting some medicine on the skin. It is about rebuilding a healthy relationship with yourself first. not with the partner, not with the people around us, but building a healthy relationship with yourself, with the psoriasis. So I usually encourage patients to communicate honestly, first of all. Instead of hiding it, communicate it. Even a simple conversation like, I'm having flare, I'm having flare, accepting that we are having it, or I'm feeling physically uncomfortable today. So I might need some support, not just the solution. That those simple things can change so much in the relationship. First of all, accepting it and being comfortable with it, and then that will help you to deal with it emotionally. And then honestly, a supportive relationship can improve the healing, of course, because supportive support reduces the stress. You feel accepted and all, and because of that acceptance, your stress is automatically, it is on the lower side. So it's very important that you share those things with your partner. You have no shame with having psoriasis. You stop isolating yourself, and yeah, that's all. It's very easy.
If someone is suffering about this psoriasis and wants to share with his partner, ask for his support, what is the first recommendation that you give during your consultations to support her, to make it easier for her to share? What is the main first recommendations to start the deal, start the conversation in a more confident stage?
Like I said, first step is, of course, accepting yourself. Once you accept everything, then it becomes easy for you to share with your partners. That is the most important. If you don't accept yourself, then you might communicate it in a different way, and that might, that might cause an impression on your partner that, they themselves are not comfortable in their flares or their condition. So it's very important. This is the first and the most important step. That's what I feel.
Acceptance,
Yes,
you mean?
correct. Yes.
Okay. Okay. And as you see during this live session, you can send your questions or comments to us. We can publish them on screen. And if you have a question, also Dr. Trapti can easily answer it during our live session. So thanks for your comments and sharings with us. So it's important that this living with psoriasis isn't a thing that you can be feel ashamed of. This is the way that that your body responds because of your maybe nutrition, maybe stress management, maybe your sleep quality, maybe your digestive disorders. There is a whole stage at there, full stage at there. So first, if you can understand the root cause of it, why you are living with psoriasis, then it's easy to understand the reasons. And if your mind is clear about the reasons, why you are living with it, it's easy to accept it at yourself, in yourself, make a deal with yourself, do it like that by yourself. And then when you accept the results, the reasons, it's easy to share as you understand the reason indeed by the root. So if you are working with an Ayurvedic doctor or practitioner, you can understand the root cause, and when you have the full idea of the root cause, it's easy to convince yourself about the reasons. So when you are convinced about it, there is no shame at there. If there is no shame, there is no stress. If there is no shame and stress, it's easy to share why it's happening and what type of support do you need with your from your partner. So that makes a lot, I think, on the psychiatric way of that crisis that we live with, psoriasis. So I want to ask as a final question to you. I think everyone who has been dealing with this for a long time, this question will be in their mind also. They are thinking about it because at some point they have tried, maybe you have tried creams, medications, diets, or maybe other alternative approaches, and you are tired of, because you each time maybe you get disappointed from what you have tried. So honestly, I want to ask to instead of the ones that are listening to us, honestly, is Ayurveda just another thing to try, or is there something genuinely different about it with the approach of Ayurveda?
That's very fair question. And honestly, people come to Ayurveda after feeling exhausted. Normally we see the patient who are exhausted from all the pathies, and they are physically drained, of course, emotionally drained, and already they have tried multiple things.
Yeah.
So, what's different about Ayurveda is that the goal is not just the symptom management, right? So, in Ayurveda, the approach is to understand why the body keeps reacting in certain way at first place. So, instead of asking what cream should I apply, what treatment, what therapy I should do, instead of asking those questions, we should ask how we normally, even Ayurveda doctor asks, how is the digestion? How is the stress? How is the sleep? What are the flare triggers? Is your nervous system constantly activated? Or is there any inflammatory food or lifestyle patterns? Like Ayurveda, because Ayurveda looks at the body in a whole system way, like it is like a ecosystem of a person. So I want to
Yes.
say this that Ayurveda is not magic. Okay, it is not
Yeah.
any magic. It will in a day, it's a psoriasis will be gone or something. Psoriasis is a chronic condition. So, of course, healing takes a lot of consistency, patience,
Mhm.
and personal care, individualized care. But many people experience meaningful improvement, not only on skin, but on their energy levels, on their sleeping patterns, confidence-wise, digestion-wise, overall quality of life-wise, they see the improvement. So, of course, no, ideally, Ayurveda should not feel like just something to try or another thing to try. It should feel like finally being seen as seen as a whole body as a person, like whole body as a system. So it is not just a skin condition.
So, what is the first step if someone is listening us and like the way you are approaching psoriasis? What his or her first step will be for the cure, for the goal that they are seeking for?
Correct. So whenever the patient comes with a psoriasis, what is my approach? Normally, first thing is the emotional level. To make the patient feel comfortable, tell the patient that you're doing good, you're doing fine, and this is very common. This is not something contagious and all. And patient themselves accepting this is the first step. Then secondly, asking
Mhm.
them about sleeping patterns, stress flat, like whatever the questions I mentioned in the earlier discussion. So like whatever the dietary patterns, sleep patterns, and all those things are there, I make sure that patient is aware that these are the things that might cause those things, because everybody normally in any pathy, body is not seen as a whole system, not in any pathy, but in modern science, it is not seen. It is seen as a symptom. Psoriasis is as a disease, but it is not as a whole body. So in Ayurveda, these things are done very differently. Like uh, the all Ayurveda, the tripod, Ahar, Nidra, and Brahmacharya, the type of diet, the amount of sleep that you're getting, these are the like pillars, three pillars of life. So based on these three pillars, we take any
Mhm.
patient and including the psoriasis, not just the psoriasis, but any patient is judged upon these three characters and the brahmacharya part. So yeah, these three are the pillars, and based on these three, we judge a patient, we treat the patient as a whole.
So great. Again, we are coming to the end of this live session for today. And thanks a lot, Dr. Trapti, for mentioning all these details for us, because I believe that what makes difference is the approach that you shared during our live session, Dr. Trapni, and you underlined once more again that it's not about the skin, it's about the whole person. And
Correct.
today, this was our second session on psoriasis this May. And what I want to mention, if even one sentence from today's leave made you feel seen, please save this conversation and share it with someone you think they may need to hear that conversation also. And if you are tired of only treading the surface while feeling unheard underneath, and I want to mention that we are here for you. Asha Experience team and Ayurveda Institute team is here for you. And during May, about psoriasis, you can have free doctor consultations of our Asha Experience team. They will be available for you throughout May. And you can only send a comment under this video after you watch it. If you write a comment that you ask for this free consultation, we will quickly come back to you, arrange the consultation with our uh, doctor for the ones living with this or caring someone who has this problem, psoriasis problem. And if you have further more questions, also you can drop your questions in the comments. Be sure that we are reading everything and trying to answer it as quick as possible we can do. And thanks to God that Dr. Trapti was with us
Thank
during
you.
today's session. And what will be your final words, Dr. Trapti?
Just like I have repeated this twice in a session, please don't treat psoriasis as something very bad happening to you. It can be treated and completely cured. Just accept it and try to seek some Ayurveda treatment. It really helps.
Thanks so much. And thank you
Thank
for
you.
being with us. Uh, and please if you like this conversation, this live session, make a like button. And if you think that this conversation also may help to your loved ones, please share with them. This makes also very huge motivation to us. We are doing these sessions to support whole human beings who are suffering from different subjects, and we believe that Ayurveda will be a nice touch to those sufferings. So your likes, shares, and becoming an partner of our journey will make a lot for us. Thanks for being with us. Have a lovely day. Have a lovely week. See you on our next live session. Bye bye.
Bye bye. Bye bye.